President Xi Jinping underscored that community remains the important defense line for the prevention of imported cases and prevention of domestic resurgence. Premier Li Keqiang put forward specific requirements of continuous efforts in mass prevention and control and effective community efforts. Today, we will focus on the optimization of community prevention and control as a solid defense line. We have with us DG Chen Yueliang from the Grassroots and Community Governance of Ministry of Civil Affairs, Deputy Director General Gao Guangming from the Grassroots Health Department of NHC, and Director Li Yongjing from the Jinsong Community Health Service Center of Chaoyang District of Beijing, Party Secretary and Director Li Meihong of Bajiaozhongli Community of Shijingshan District in Beijing. The guest speakers will take questions on service for the key risk groups and the precise prevention control measures carried out in communities and answer questions. Some updates on the pandemic in the 24 hours of April the 10th, according to reports from provinces, cities, and the Xinjiang Production Construction Corp. New confirmed cases 46, including 42 imported cases. And they were found in Heilongjiang 22, 10 in Inner Mongolia, 4 in Shanxi, Beijing, Tianjin, Liaoning, Jiangsu, Shandong, Guangdong, 1 respectively. 4 were domestic cases, 3 in Guangdong province and 1 in Heilongjiang province. New deaths 3. All were Hubei cases. New suspected cases 8. All were imported cases, 5 in Heilongjiang province, 2 in Shanghai, 1 in Jiangsu. On the day, newly cured and discharged from hospitals 70. Close contacts that have been removed from medical observation 1,411. Severe cases were reduced by 3. Some words on the imported cases. Remaining imported confirmed cases 734, including 37 severe cases. Remaining suspected imported cases 44. Cumulatively confirmed imported cases 1,183. Cumulatively cured and discharged from hospitals 449. No death case among imported cases. As of 24 o'clock, April the 10th, according to reports from provinces, cities, and Xinjiang Production Construction Corp., remaining confirmed cases 1,089, including 141 severe cases. Cumulatively cured and discharged from hospitals 77,525. Cumulative deaths 3,339. Cumulatively reported confirmed cases 81,953. Remaining suspected cases 44. Cumulatively traced close contacts numbered 718,050. Those who remained under medical observation as close contacts 10,435. In Hubei province, there was no new confirmed case, no new suspected case, no remaining suspected case in the province. Newly cured and discharged from hospitals 28, including 27 in Wuhan. New deaths 3, including 2 deaths in Wuhan. Remaining confirmed cases in the province 320, including 319 in Wuhan, among which 95 were severe cases and 94 severe cases in Wuhan. Cumulatively cured and discharged from hospitals in the province numbered 64,264, including 47,112 in Wuhan. Cumulative deaths 3,219, including 2,577 in Wuhan. Cumulatively confirmed cases 67,803, including 50,008 cases in Wuhan. According to provinces, cities, and Xinjiang Production Construction Corp, new asymptomatic cases 34, including 7 imported asymptomatic cases. On the day, 14 were confirmed. All were imported cases. On the day, 25 people were removed from medical observation. 4 were imported cases. Those who remained under medical observation as asymptomatic cases, 1,092, including 338 imported cases. From Hong Kong, Macau, and Taiwan, cumulatively reported confirmed cases 1,416, including 989 in the Hong Kong SAR, 45 in the Macau SAR, and 382 cases in the Taiwan region. On April the 10th, remaining severe cases in Hubei province for the first time were reduced to below 100. In recent days, in individual provinces, there were the clustered cases. So we'd like to remind the general public to remain cautious and do not engage in public gatherings. Local governments should continue with monitoring on the key risk groups and organizations so as to minimize the risk of further transmission. Now we'd like to take questions from the floor. Please ask questions around today's topic, and please identify yourself before you ask your question. Journalist from the first row on the right side, please. With CCTV, the Political Bureau of the Party Central Committee stressed that with routine prevention control efforts, we need to promote the resumption of business as well. So for the routine prevention control measures adopted by communities, will there be any changes? What about the services provided by the homemaking sector, maintenance people? They find it difficult to enter into the households. So what are the measures installed to deal with the difficulties? I'd like to ask DG Chen Yueliang to take the question. On April the 8th, President Xi Jinping replied a letter to the community workers in Donghu district of Wuhan. And he underscored that community is an important line of defense for prevention of imported cases and prevention of domestic revival. And he has stressed that when the prevention control is our daily routines, community workers are expected to be pragmatic, to make painstaking efforts with passion to serve the general public and contribute to the winning of this people's war. These important messages from President Xi have guided us in the routine efforts carried out by communities in the disease prevention control. The community epidemic prevention control has already become a priority routine. Community workers must build a consolidated defense line. The routine efforts are in 4 aspects. First, there should be consistent and persistent efforts in consolidating the defense line. Second, differentiated treatment services. Third, precision management in promoting the use of health QR codes, leverage information technology to manage the imported cases prevention, people returning from high-risk groups, and also the management of staff who are working in the public service sectors. And the next is the social coordination.
At the moment, the priority is to develop the regulation or specific rules concerning the public services. I call on the relevant stakeholders to play an active role. The Ministry of Civil Affairs, the NHC, are going to jointly issue the community-based prevention and control measures or technical guidelines in this respect. There will be categorizations of the localities according to the risk level, and also they will be divided into 3 groups of communities with the low, medium, and high risks, and there will be well-targeted measures to specific communities. Furthermore, the application of information technology will also become one of the key tasks, as the IT application can help the localities to improve their efforts and take the epidemic prevention and control as a regular work. In order to win the final battle against the pandemic, the communities must motivate the community workers. The key here is to implement the relative policies which show care to the community workers. The central government has already worked out a relevant technical guidance and also established a relevant mechanism to guide the work at the community level. And also, for both urban and rural community-based workers, there are technical guidelines for them. Up to now, 28 provinces and municipalities have already worked out specific work plans and relevant technical guidelines. The localities are urged to follow the central government's requirements. As for the specific technical guidelines or the difficulties faced by different sectors, I think the localities need to accelerate their efforts to implement the central government's policies and the relevant regulations. At the moment, the situation is still quite posing severe challenges on pandemic prevention and control. Many localities are still having the status as a level 1 emergency response. And also, for communities which are of high risks, they should pay particular attention to the relevant efforts, such as the health codes of the key sectors. And also, at the same time, we should accelerate the work and the normal life recovery for people who intentionally falsified the health code and try to evade the legal or the law-based monitoring. They should be held accountable and be penalized. Thank you. Thank you. Let's continue the Q&A. On the left, on the front row, the First Lady reporter, please. Thank you. With China Community News, recently, President Xi Jinping wrote a replying letter to the community workers in Donghu community in Wuhan, affirming the important role of community workers. May I know the central government's efforts to ensure the smooth operation at the community level? Also, Wuhan has just lifted the lockdown, and what are the things to pay attention to? Okay, we will have DG Gao to take your question. Okay. In early February, in the light of the epidemic prevention and control, the central leadership team dispatched a team to Wuhan to guide the work there. More than 20 experts were divided into 3 teams to visit the various districts in Wuhan. After about 2 months of work, now the sub-teams have already visited all the communities and all the streets in the 13 communities. They have summarized the over 1,000 comments and provided feedbacks. Their work has been highly acclaimed by the local people. For the sub-teams, they have the important tasks as to see with their own eyes whether the prevention and control measures are in place. They were also asked to listen to the feedback or the comments and the suggestions made by the local people. And the third task is to report, that is, to collect the common problems and report them to the decision makers. And the fourth major task is to help. These sub-teams are not only to asked to identify problems, more importantly, or more also, they are requested to provide specific suggestions to solve the existing problems. So indeed, their feedbacks have been well received by the local people and the local institutions. Now, with 2 months past, I think we can summarize the work of the teams or the task forces as the following experience. The first is to implement the specific policy requirements and apply the well-targeted measures to conduct the prevention and control at the grassroots level in a down-to-earth manner. And second, the local and helpful experience is summarized by the task force. In Huangpi district, for instance, they took the initiative and had the early interventions, and their experience has been summarized and promoted. Furthermore, the members of the expert teams or the task forces have also put forward the suggestions. As you may remember that on February the 5th in Jiang'an community, it was first adopted the enclosed or the closed-loop community management approach. Actually, this was a suggestion put forward by the task force, and then starting from February the 15th, all the neighborhood communities in Wuhan began to apply this approach. I think it is fair to say that these sub-teams have made a lot of efforts helping the local government to improve the epidemic prevention and control. For the next step, as Wuhan has already lifted the lockdown, however, the communities still serve as the front line in the fight against the epidemic. Therefore, we should emphasize that emergency response should be conducted while the new normals should be well implemented. And the second, to intensify the efforts against the pandemic, especially engaging the local communities. And thirdly, we should continue to emphasize the closed-loop community management. And last but not least, the most important thing is to have the 4 earlies:
early identification, reporting, quarantine, and treatment, so as to contribute to the final win of the fight against the epidemic. Thank you. DDG Gao Guangming is the Deputy Director General of the Grassroots Level Health Department of the National Health Commission. He is also a member of the national team to Wuhan. He has been working in Wuhan for 50 days. So his sharing was from his own experiences. I'd like to again thank DDG Gao Guangming for your sharing. Next question, please. Journalist from the second row on the left side. Thank you. With the CCTV, the financial channel, now we are still having arduous task of community prevention and control. There is still the risk of revival. How should we optimize community prevention control measures, in particular the precision measures? I'd like to ask Director Li Minhong to take the question. Thank you for your question. Community is the front line of the pandemic prevention control. In the context of accelerated resumption of business, our priority is the safeguarding people's life and health. At the community level, prevention and control and services are equally important in prevention and control. The gates of the communities, the gate of the building, and the gates of individual households are equally important. We have access control, temperature monitoring, regularly disinfection and sterilization. We've also put up posters on the doors of those who haven't returned to Beijing. In services, we focus on 3 types of people. First, the homestay ones who are under observation. We send a team of 6 to send meals, express deliveries, and dispose their daily garbages. At the maximum, we serve 150 households like this. 5,000 person times have been served. The second type of people under our service special attention are the dependent but the elderly but who are living in solitude, and also the disabled. We buy them medicines. We also take stretchers when they are in need. Third type of people are those who are breaking the regulations, like those who are engaged in gathering and who do not wear masks when they go out. So we let their neighbors to persuade them. Thank you. Next question, please. Journalist from the second row on the right side. Thank you. With CNR. With the prevention control measures becoming a daily routine, many hospitals have resumed their normal operation. Grassroots level health institutions need to strike a balance between prevention control efforts and the regular and routine services for the children, the elderly, and the chronic disease patients. So for community health service centers, how can they strike a balance, and how do these health professionals working in health service centers safeguard their own health? I'd like to ask DDG Gao Guangming and Director Li Yongjing to provide answer. First, DDG Gao Guangming. As the phase-on successes need further consolidation, industries are picking up the speed of business resumption. Many health institutions have gradually restored their routine services. The combining efforts in prevention control of COVID-19 and the regular services have gained equal attention. They've innovated their working methods and made holistic arrangements over prevention and control and chronic disease management so as to ensure the basic health needs of the citizens can be met, and the citizens in rural and urban areas can access health services in adjacency to their residence. As to the specific efforts taken out by community-level health service centers, I'd like to ask Director Li Yongjing to provide an answer. Thank you. In the context of COVID-19 response, in our community, we provide health services to the citizens by providing some appointments. The general public is accustomed to making appointments online. The elder citizens and the chronic disease patients are quite accustomed to the appointments. GPs will have some referral, will have some follow-up appointments. Sometimes the appointments are made by telephone calls. And also, Chaoyang District have a health APP, which means many can have an appointment online by using the cell phone APPs. The appointment can reduce the crowd, reduce the waiting time, with a view to reducing cross-infection. We also have a hotline of services for the elder citizens, for those who are above 80 years old. They can use the hotline to learn about the use of certain medicines. Health tips are also provided through this way. During the COVID-19 response, we provide health tips to the elder citizens, many of which have been asking us whether they need to wear masks at home, whether they can go outside for a walk. We have been very patient in taking all these questions. We also provide health tips and psychological counseling via phones. For the children vaccination, we also have appointments and stagger the timing of children's vaccination to ensure the safety of vaccination and to prevent against cross-infection. We also have sustained health management of chronic patients. By leveraging smart technologies, we have provided follow-up visits to answer their needs and to answer their questions. Thank you. Next question, please. Journalist from the second row on the right side, please. With Hong Kong China Review, we've noticed that some netizens said after the discharging from hospitals, some of their neighbors may have a profound concern of their potential infection. So for the communities where there are cured COVID-19 patients, what should be the special measures adopted? DG Chen Yuliang is taking the question. Thank you for your question. The patients who are about to be discharged or who have been discharged from hospitals, communities are where they live. It is where their homes are. They need to go back to the communities to live a normal life. And also we see many people coming back to communities, which is an commendable feat in our country. Everyone may get sick. It is never terrible to get sick. That is universally true, and we shouldn't have bias on sick people. Without the efforts and the contribution by Wuhan and the Hubei province, we couldn't have had the great feat in the country. We should be grateful. Currently, we do not yet have proven effective dedicated therapy for the treatment of COVID-19. Therefore, we must ramp up efforts in the following aspects. First, for the discharged patients, we should have a good management service in accordance with the State Council's Joint Agency Task Force, follow-up visits, working measures, and make timely, accurate, and precise understanding of their basic information. We should collaborate with designated hospitals to establish a registration for follow-up visits. We should have good quarantine and observation systems, regular follow-up visits, psychological counseling, and health monitoring. All these measures should be in place. And we should account for their needs and urge them that during their home stay, a good atmospheric ventilation and daily disinfection should be ensured.
Second, the people who have been cured and discharged from hospitals can enjoy their lives afterwards. Some communities are a little bit concerned about these recovered patients, and there might be some discrimination. According to experts, such concern is unnecessary. The communities should bring into full play the role of the community workers and guide the residents to get rid of such unnecessary fear. And thirdly, we should strengthen the public advocacy in localities with available conditions. With the consent of the recovered patients, online discussion or talks can be conducted so that the recovered can share their experience and promote mutual understanding. The community should promote empathy and compassion, eliminating the potential discrimination against the recovered patients, and building a rational and mutual respecting community. Fourthly, to make earnest efforts to develop response plans in case there's a reactivation of the nucleotide results, and in case of any reappearances of the symptoms, the local community should immediately connect the relevant healthcare facilities and transfer the reactivated cases. Also, the communities are expected to do a good job with the community health and strengthen the health monitoring on the residents. The residents should be mobilized to be engaged in community health. Okay, let's continue. On the left, on the fifth row, the first lady reporter, please. Thank you. With Xinmin Evening News, we understand that up to now, there are still neighborhood communities who bar the entrance of the delivery boys and men. Yesterday, the central government issued a policy circular allowing the delivery expressmen to enter the neighborhood communities. So how to implement such policy? We will have Madam Li to take your question. Thank you for your question. We are following the central government's and the Beijing municipal government's policy guidance. On the one hand, we are trying to ensure the health of our community residents. On the other hand, we are implementing the government's policy. So we have already issued the specific technical guidance to the delivery men so that they can deliver the goods and parcels to the residents in a timely manner. Okay, let's continue with China Daily. From the Spring Festival to now, the community workers are always working in the front line. They have been under big pressure. So how about the current situation? Are the communities sufficiently equipped with human resources? We will continue to have Madam Li to take your question. Thank you for your question. Well, indeed, we are faced with big pressure. This is because we are entrusted with big responsibility as we are in the capital of the country. Also, working at the community level, we are faced with all the details. In my community, we have more than 7,000 residents while we only have 16 community workers. Up to now, they've already provided services to all these 7,000 plus residents. Though their homes are not far from the community, they still cannot go back home to take the rest. However, we are not alone because we have all the stakeholders and partners like the community residents. What we also feel very encouraging is the support from the government. The central government works out 8 policy measures to help the community workers. And in Nawa Street, we also have received support from the district government and also the large community committee. Also, we have been arranged to take 1 day off every week. We really feel greatly encouraged. Okay, let's continue. On the left, on the third row, the first lady reporter. Thank you. With People's Net, we know that community healthcare facilities play important role in early reporting and early detection. Now, many migrant workers are coming back to the Beijing communities. So I would like to know the role of the community healthcare facilities and how do you conduct health monitoring? We will have Mr. Li Yongjing to take the question. Thank you. Since the outbreak, the community healthcare facilities are entrusted with a lot of tasks. Up till now, my community healthcare center has transferred 18 patients and conducted 41 nucleic acid tests on suspected cases. Furthermore, together with the stakeholders, we have managed the returned overseas Chinese and their family members. We have followed very closely the close contacts, and also we provided the early reporting and early detection for people who came back to the community when they were having the home-based quarantine. We will follow their potential symptoms very closely. Once there is a symptom, the family doctor will be contacted and the family doctor will do the assessment. If it is necessary, we will call the ambulance to bring the suspect case to the designated hospital. In case of comorbidities or the underlying conditions, we will treat such underlying conditions at the community level. But if there is a severe case, we will surely transfer the patient to the designated hospital, and we will send designated staff to accompany the patient transfer. And also, in the homestay quarantine, we ensure the closed-loop management, and also we provide the necessary medical treatment. In facilitating the work recovery, together with the local CDCs, we conduct training and also provided guidance for patients with very clear diagnosis. When they come back to the community, we will do the follow-up work. Okay, thank you. Let's continue. On the right, on the fourth row, the third lady reporter in blue, please. Thank you. With CCTV News, New Media, my question is, it is known that there are many chronic patients who are concerned about their access to the NCD drugs. So, can they get access to the NCD drugs, and how can they prepare themselves for such drug access?
Director Li Yongjing will take the question. Thank you. to reduce the frequency of hospital visits and to prevent the nosocomial infection, community health service centers have provided the following services: the streamlined procedures for medicine collection and the delivery of medicine to the doors of the chronic patients. First, for the clearly diagnosed chronic patients with a stable progress of the disease, we may prescribe an administration for 3 months. Second, we've streamlined the medicine collection process. Also, for the patients with a clear diagnosis and a stable progression of the business, we have changed the regional way of registration and medicine collection and payment. The GPs can have the interaction with the patients online to have exchanges and prescribe virtually. The virtual prescription will then be transferred to the pharmacy. Pharmacy will then discharge the medicines, and the patient can register outside the waiting zone, and they can collect the medicines that have been prescribed by them. They don't have to enter the hospitals. The third way to get around this is to deliver the drugs to the disabled or semi-disabled patients or elderly. They can enjoy the drug delivery services. For the elderly who find it difficult to walk on themselves, their family members can collect the medicine on their behalf. So we have the whole set of measures in place to ensure the chronic patients can have their regular and routine medicine administration. Two last questions. Journalist from the fourth row on the right side with the National Business Daily. In previous press conferences, we've learned that there were an array of measures to support the vulnerable groups. However, in reality, they may encounter many specific difficulties when the prevention and control of the pandemic has become a part of the daily routine. How can we account for their worries? I'd like to ask DG Chen Yueliang to take the question. Thank you for your concern in the most vulnerable group with the special difficulties, the elderly, the children, the disabled, and other people with specific difficulties. Compared with the ordinary people, they are faced with more difficulties. And they are the group of people that need the most care from us. Since the outbreak of COVID-19, civil affairs authorities have provided specific help for these vulnerable people. We've made a specific deployment. We've leveraged the community workers, volunteers, and civil organization workers. There are specific work carried out by community workers. Following the deployment of supply, they have been working with volunteers and paid door-to-door visit to deliver the supplies, the essentials, to help them deal with the specific difficulties, thus ensuring their livelihood of the vulnerable group. Of course, sometimes there are difficulties for those that we can do. We will do them well, and we have been pursuing at our best to satisfy their needs. In the context of prevention control becoming a daily routine, we need to mobilize the entire society to care the most vulnerable groups in the following aspects. First, we need to promote civil affairs authorities to have precise time and region-specific prevention control measures and gradually restore the normal life in communities, in particular in the low-risk rated regions. They need to open the places that provide daily essentials and provide convenience and services to the elderly, the children, and the vulnerable, and create opportunities and conditions for the resumption of business. Second, we can set up not only full-time but also part-time posts for community workers. The community workers are working under great workload, and if we solely count on them, on the full-time community workers, they are overburdened and the work remains uncompleted. Therefore, we suggest the establishment of some part-time community worker posts. On one hand, we can provide job opportunities. On the other hand, these part-time community workers can also help in providing services to the vulnerable groups. Third, we can optimize and improve some work guidelines, support the community workers, volunteers to engage in psychological counseling and psychological support services. We can guide the stakeholders from different streams to help the vulnerable groups. Besides, we can also innovate the working methods by summarizing and reviewing the previous effective practices, improve the institutional design, promote the services that are more refined and precise and smart for the vulnerable groups. Another core issue with the vulnerable group in communities is that we need to allow the entry of homemaking sectors. Without their access to communities, it is not possible to solve all the detailed problems. Government cannot solve all the problems, but government can create conditions for other stakeholders to come in and solve all problems. The vulnerable groups need to get special care and attention. We also call on the citizens, residents in communities to help each other, to be galvanized and to act with community workers and jointly care the most vulnerable. Thank you. The last question. Journalist from the fourth row on the left side, please. Thank you. With the Shenzhen Special Economic Zone News. You've mentioned that as business is resuming, there has been an increase of the people movement, which has constituted a higher risk. In this new context, how can we step up routine prevention and control at communities to ensure more precise measures can be adopted? I'd like to ask Director Li Meihong to take the last question. Thank you for your question. As prevention control has become a part of our daily routine efforts, we need to make more solid, pragmatic, and refined efforts. We should be good gatekeepers and bar the entry of any risk and ensure the prevention and control is smart. The first generation of access card can be fabricated and can be easily damaged, so we've freely made and distributed smart cards, the second generation of access cards. So it is around-the-clock segmented management. Second, we should also be acting like a delivery man. We need to carry out refined services. Household has become the basic unit of our service target, in particular the vulnerable people, including the elderly, the disabled, and the leftover children. We've provided door deliveries. Third, we need to be the health gatekeepers. As businesses are resuming, many of the cadres from competent authorities may go back to their original workplaces, but we don't worry at all because we can count on the people. The neighbors can help each other. We also have a 1, 2, 3, 4, 5 mechanism, which has played an important role.
We are also going to consolidate our experience and improve the community governance so that people living in our community can live a happy life. Thank you. Thank you to the speakers. April is the month for patriotic health campaign, and the theme for this year's patriotic health month is everyone is the first person responsible for health. So tomorrow we will have the relevant government agencies like the NHC, the Patriotic Health Campaign Office, and the Ministry of Rural Agriculture and Rural Affairs, and etc., to come to the press conference. That's all for today's conference. Thank you.